Welcome to this Danone Ecosystem webinar. I'm Nicolas Gausserès. I'm the Deputy General Manager of Danone Ecosystem, and I'm really happy to welcome you today. Good morning, good afternoon. Danone Ecosystem, in a nutshell, this is a platform that invents collaborative models for systemic change and societal impact, with a clear objective, clear ambition, conviction that a company cannot thrive without a healthy ecosystem, without caring about its own ecosystem. Today we are all together in order to showcase an holistic approach, a concrete project supporting the health of elderly people in the Netherlands. So I'm very happy to pass over to Alexandre.
Thank you, Nicolas. Bonjour, hello, and welcome to this second Danone Ecosystem webinar. And today, as Nicolas just told you, we are discussing a topic that touches us all: how to transform healthcare system to promote healthy aging. Because the truth is, we keep aging older. Just over the 20th century, life's expectancy more than doubled. Actually, it grew by 65%. And the trend keeps going. Just between 2008 and 2014, we gained 2 years of life expectancy. Today, the average life expectancy of a European woman is between 81 and 84 years old, while a European man tends to live up to 70 or 80 years old. But the real issue is not whether we should or whether we can just grow older, but how to age better. How do we take care of our elders? How do we keep them autonomous for as long as possible? How can we help communities to provide the services that our elders need once they're less autonomous? And these questions, they're of course economical, they're political, but most of all they're human. And they matter to our communities, and they probably matter to you. If you are a senior already, they matter at very first hand. And if you're not a senior yet, well, chances are you will be. And you will probably like to have access to a program that is centered on the well-being of senior citizens. And that's actually what we'll be discussing this morning. We are discussing such a program. It's called TOM, which translates in English to Best Frailty Care. It's a Netherlands-based project. It aims at helping the aging population to live independently at home for as long as possible through full and isolation prevention. And it has been co-created and co-financed by Nutricia Benelux, Danone Ecosystem Fund. Sorry, my Netherlands is a bit rusty, so let's try this one. VeiligheidNL. It's an accident prevention organization mandated by the Ministry of Health, ONVZ, the health insurance company, and gathers multiple additional partners such as Philips, Purpose, it's a health consulting agency, and the municipalities. And it was launched in 2017, and it delivered scientifically proven results. And if you doubt me or what I'm saying, which is perfectly fine, then just listen to 91 years old Hans. She has a message for you.
Ik ben Ans Schrover van Koningsbrugge. Ik ben 91. Mijn man is 20 jaar geleden overleden. Mijn kinderen wonen in Nijmegen, dus ik heb toen geaarzeld. Zal ik hier gaan wonen in een flat of zal ik naar Nijmegen gaan? Ik ben hier gebleven en daar ben ik blij om. Je woont hier erg prettig in Rotterdam. Het is goed om in je eigen omgeving te blijven. Dus met je eigen vrienden en mensen die je kent en waar ik erg veel mee optrek. Ik woon hier nu al 20 jaar met veel plezier. Ja, ik voelde me hier thuis en ik had genoeg te doen. In de Havenloods, dat is zo'n plaatselijke krant, had ik gelezen over zo'n object, over wat zou gaan komen. En ook dat dat op de markt op een vrijdagochtend een beetje gepromoot zou worden. Toen heb ik me gauw ingeschreven en toen was ik heel nieuwsgierig naar de eerste bijeenkomst. Het was wel een grote groep. Ik zag er geen bekenden. We kregen wat uitleg en hoe de planning was en het klonk allemaal goed. Dus ik wou het graag proberen. Ik was blij dat ik erbij mocht komen.
En het programma eigenlijk uit 3 pijlers bestaat. Dus inderdaad het oefenen, wat wij dus fysiotherapeuten doen. En de voedingsadviezen door de diëtisten. En inderdaad het sociale aspect van het hier in het buurthuis doen. En dat de mensen elkaar kunnen ontmoeten. Ik denk dat dat de kracht is van het programma.
We hadden die lunches en toen kreeg ik andere ideeën erbij. Dus ik maak nog altijd wel eens de bietensla. Dat is makkelijk en lekker en gezond. Ik zorg dat ik meer eiwitten naar binnen krijg, dus ik eet 2 keer op een dag zuivel. Wat ik vroeger niet deed. En zulke soort dingen, dat heb ik er echt van geleerd. Die lunches waren toch erg leuk, omdat je ook dan met de anderen tijd had om te praten. Ik vond onze fysiotherapeut Ronald heel prettig. En de groep was ook erg leuk naar elkaar, dus dat was ook prettig. Bijvoorbeeld ook geleerd om je gewicht goed in balans te houden. Dus ik let wat meer op dat ik stevig sta. Als ik bijvoorbeeld het bakje met eten voor de poes neerzet, dat ik niet ondersteboven ga, maar dat ik even wat beter mijn gewicht verdeel door goed te gaan staan. Ik werd er wat zekerder door. Ja, dat was heel prettig. Eigenlijk pluk ik er nog steeds vruchten van. Ik zou het zeker aanraden. Ik heb nog steeds dingen die ik doe op een manier zoals ik het toen geleerd heb. Ik zit heel dikwijls met mijn tenen te wiebelen bijvoorbeeld, want dat is goed voor je bloedsomloop. En je voeten worden ook een beetje oud natuurlijk. Die willen niet altijd zo goed. En dat werkt, daar is het ook voor je bloedsomloop. Dus ik heb dat soort dingen gedaan. Maar ik heb ook op eetgebied wel het een en ander veranderd. Ik vind het fijn om zelfstandig te zijn.
I wish we can all be as happy and as healthy as ants when we will all be 91 years old. And this morning we are looking at a program that aims to do just that. But before we get to the program, if we are to understand how to transform healthcare system to promote healthy aging, we must start from the need and challenges of all stakeholders, society as a whole, but municipalities on the field, and even companies. And to give us a much needed overview of this issue, we are joined right now by Saskia Kloet. She's a public health professional with more than 17 years of experience in elderly care at, and I'm here dusting up my Dutch, VeiligheidNL, which is an independent NGO that works with the Dutch government on injury prevention. Welcome, Saskia.
Good morning and good afternoon. And you pronounced it very well.
Great, thank you. I must say I practiced quite a bit this morning. Saskia, could you just please tell us, what are the challenges facing seniors and elderly today? And why is this very topic of healthy aging the key?
If you look into this from a more senior perspective, I think healthy aging or aging raises challenges on many different levels, such as social, mental, and physical levels. And as you already mentioned, elderly are getting older, and with the growing age, frailty also increases. And this is making it much more difficult to reverse the effects of physical or psychological incidents. Chronic illnesses, hospitalization, incidents like a fall accelerate the deterioration of the state of health and push that person more towards dependence. And that is something, as you already saw with ants, something elderly really do not want to become. And numbers don't lie. Looking into malnutrition, I think an average of 20 to 40% of elderly is at risk for malnutrition. Looking into falls, 1 in 3 elderly of 65 years and older are at risk of falling. And looking into the specific group of 75 years and older, it's already 1 in 2. So the number of falls are increasing, and a fall actually is kind of a critical incident and a tipping point that can trigger a cascade of events. A fall leads to a fear of falling, which can lead in turn to less physical activity, less mobility, increasing risk of a subsequent fall or injury, also leading to malnutrition, isolation, etc., ultimately meaning a decrease in self-management and independence and loss of quality of life. From a more society perspective, I think aging population impacts healthcare system, but also retirement systems globally. If you look more specifically into the growing number of falls, this raises challenges into the availability and quality of acute and long-term healthcare. And next to an increase in needed capacity in healthcare, I think we also see an increase in healthcare-related medical costs. Only in the Netherlands, the direct medical costs related to fall incidents of elderly in 2019 were already over 1 billion euro. And it is expected to double within 8 years from now. I realize this is not a very positive perspective on this topic, but luckily there is a ton of knowledge and evidence in how to improve healthy aging and prevent falls and malnutrition. And we need to shift our models from care to prevention. Early screening of elderly at risk, followed by effective preventive measures, are key and requires effort from governments, communities, cities, and elderly. And I think together with lovely people like Ans, we learn more about this every day.
And as you just mentioned, it's a coalition, right? And you mentioned a key member of this coalition. You just told us about the costs. They're calculated on a national level, but taking care of our elders, well, it tends to be the responsibility of municipalities, as you just mentioned. And that's why it's very important for us to hear directly from one of their representatives. Nicole Van Winden works for the city of Rotterdam as a health policy advisor. She's our next guest this morning. Hello, Nicole. Thanks you for being with us. Nicole.
Good morning.
Share with us the challenges that the city of Rotterdam faces. And Rotterdam is actually where Ans is leaving. So, what challenges are every Ans of Rotterdam facing when it comes to taking care of the elderly and your elderly?
Yeah, thank you. Good morning, everybody. Thank you. And as Saskia and also you, Alexandre, already mentioned, in the Netherlands, about 20% of the population is aged 65 years or older. And it's estimated that in 2035, 129,000 seniors will live in Rotterdam. And with that, majority of these seniors are aged 70 years or older. And together with other stakeholders, such as the national government, healthcare institutions, and healthcare insurance companies, we have the moral responsibility to take good care of these elderly to ensure that they can continue to live comfortable and safety at home, and those grow happily and in good health. But unfortunately, growing old in a good health is not guaranteed, and old often comes physical and mental challenges. In the Netherlands, for example, half of the elderly age over 75 years experience at least one fall a year. And a fall is the number one cause of injuries and non-disease related death. And a fall may lead to various circle of fear, isolation, and loss of mobility. So therefore, it's important for the Netherlands to find solutions that we can focus on prevention rather than curing consequences of falls in cooperation with other stakeholders.
I'm stricken by what you just told us. So fall is the number one cause of death, which is non-disease related. It's huge. Yes. It's a major problem, and falls and frailty are the major issue. And as Ans was telling us in the video, nutrition is a key part of combating this risk of frailty. Yes. This is why Danone got involved through Nutricia. And Evren Dogu, you work at Nutricia, where you are the vice president in charge of all nutrition in the Netherlands. This is where the projects happen, of course. Thanks for being with us this morning. Nutricia is a company, of course. But tell us how you approach the issue of the elderly and really what challenges you faced as a nutrition company.
Thank you very much. Actually, Saskia explained quite well why this very topic of healthy aging is very important. Actually, we believe in the importance of topic. We cannot ignore that this is a huge global trend. As Danone Nutricia, our mission is to serve lives. And we believe that we agreed years ago that we need to embrace and serve these additional years of lives and this new tribe in the society. So this was one of our key agenda topics in Nutricia. Of course, it was not very easy. There were quite a lot of challenges during the program. First of all, frailty is a key therapeutic area for the health system, but it is very hard to reach out seniors. If we look at the data, 80% of the people who should get special support regarding nutrition, they do not have access to it. So that was one of the challenges that we faced. And then the second one, frailty, even if it is a huge problem, it is still a difficult one. It's a difficult concept even for the healthcare providers. And on top, we observe silos between the different healthcare professionals looking at this topic. So when we looked at all the challenges around the topic of frailty, we thought that it is super important that we take it seriously. And that is why we wanted to support this program since the beginning of it.
We see how intricate these challenges are, whether they're from the municipality perspective or the business perspective. But as Saskia was saying, what we need is to shift our approach to these challenges. What we need is a new framework, and this is actually the very concept of TOM that we're discussing today. We've talked about the challenges. Let's now get into the possible solution. And to give you an overview of this new approach, we're now joined by the TOM project manager, Inge Mohede. Inge, hello.
Hello. Good morning. Good afternoon to you all.
Good morning, good afternoon. Well, good morning to you. You're in the Netherlands as well. Inge, could you please tell us, just what is this model that we're talking about and how does it work?
Yeah, thank you. I think there will be a slide shared with you showing that TOM is a group-based fall prevention program which can be offered to older adults with the age of 65 plus and with a increased risk of falling. The program itself is quite unique in its approach. And you can see in the picture that there are 3 components which make the program quite unique because the 3 components are offered in a structured multidisciplinary intervention. And if we start on the left side with the first component, the nutrition component, it's organized around different group lunches where different themes were discussed with the elderly and where different themes related to healthy eating and drinking were shared with the participants. On the right side, you see the exercise program, which is taking place 2 times a week and supervised by the physiotherapist. And in the middle, you see what we call the social component. I've already mentioned TOM is a group-based intervention. And it is because of this group element that we see the benefits on compliance in the program. So they can meet other older adults, seniors to connect with. And on top of that, they can be supported if they want by what we call a TOM mate. And a TOM mate is a volunteer trained by the TOM program to be a kind of point of contact for the elderly during the program if needed. So I hope I clarify to you a little bit the key components of the TOM program.
Well, we see that it's quite comprehensive. It has these three branches that you mentioned, but that's the model. And let's be honest, implementing a model is always different than imagining the model. So, and it means tailoring it to local context. Saskia, I'd like to get back to you. What happened when you rolled out this approach? What happened when you tried to make this project real? And I'm asking to you because you work both for the NGO, but you also have contacts with the Dutch Ministry of Health. So how did it happen in real life?
In real life, I think that was one of the key components why VeiligheidNL really wanted to participate in this program. As I already mentioned, there is a lot of knowledge already available on evidence in healthy aging and falls prevention and malnutrition, but we really need more experience and knowledge in how to implement this into practice. And with this program, we got the ultimate opportunity to bring all this knowledge into practice from a holistic approach. We tested the program in 5 cities, and we called that living labs. And each city had different systems, different structures, different involved local professionals. And in each city, in each living lab, we learned. The program evolved. The program was adapted to the seniors' preferences, and latest update is we even also built a program that is adapted to the new COVID context. I think if you look at the relevance, results of the research only confirmed the value and the relevance of this holistic program put into practice, and it is shown from the participants who has a new dinner date. Reduce the number of falls, but also the financial win of the program. On average, each participant of TOM saves around 500 euros of direct medical costs. And we are now working together with the Dutch government on policy making that facilitates the upscaling and sustainable implementation of these kind of programs.
I'd like to stick with what you just said at the end about the beneficiaries, about our elderly, about what it brings to them, because actually this is probably what matters most. Nicole, what impact did the program have on the senior citizens of Rotterdam that took part in the TOM project?
Yeah, that's a very big impact, because this integrated program helps city to play an important role in prevention and to impact the physical and social health of the older citizens. Cities aim to support community care and facilitate the transformation from cure to prevention. And in 2019, we carry out the TOM program with almost 80 older citizens in Rotterdam. And the overall results were very positive. Nearly half of the participants experienced significantly improved health after finishing the program. And the program also showed positive results for subjective measures. For example, 6 months after the program, strength and balance were improved significantly, and the total amount of falls will decrease by 50%. Participants adopted a more healthier diet following the recommendations, and 2 out of 3 of the seniors increased a social interaction sustainably at the end of the program. So following these positive results, we took the first step to incorporate TOM into our local healthcare policy in Rotterdam. Each year, 4 TOM groups will start in neighborhoods where many elderly people live. However, in order to facilitate implementing this program across the entire city of Rotterdam, we're still looking for more long-term ways to finance this program. For this, we are depending on the national government and the health insurance companies to reach even more elderly people.
That's one of the ways of this new approach we're discussing. But I hear that from a health perspective and a community perspective, all of this makes sense. I'd like to go back to the business perspective, or at least the company's angle. Evren, why does it make sense for a company such as Nutricia to be part of this? You know, how can Danone, through Nutricia, contribute to that model?
Nutrition is very important in taking care of the problem. It should be part of the integrated care. To keep being healthy, it is very key for the seniors to adapt their diet to their specific nutritional needs. To give some examples, they have to eat more protein. They have to improve the distribution of intake of protein over different meals to maintain their muscle mass and to keep their strength. They need to consume vitamin D, they need to consume calcium, which is known to bring a higher bone density and therefore decreases the risks of fractures. If we look at all of the nutritional needs and everything, we know that specialized nutrition is one of the solutions that exist to help some seniors to consume the nutrients that they need without having to eat as much as before, or even when chewing is a challenge for them. And what is powerful about this program, about this model, is that seniors get the right screening regarding their nutritional needs and regarding their possible deficiencies, so that they can concretely adapt their diet with or without specialized nutrition. And as a company who is specialized in nutrition, it is super important that we were part of it. And on top, it is part of our DNA in terms of the approach as a B Corp and mission company to accompany seniors according to their age-related needs.
Nicolas Gausserès, you're Danone Ecosystem Fund Deputy General Manager. We're at your place. Did the ecosystem, Danone Ecosystem, get involved only to stay true to its mission statement, as we just heard, or is there something more to this approach? What does it bring to the table?
Yeah, as I said at the beginning in my introduction, the challenge is really about the systemic change. And everything that you have heard is about systemic change, because Danone Ecosystem is part of the project for a while and will not last forever. The systemic change, you have heard that it is about an ambition to move from treatment to prevention. It is about bringing to the table the right partners, and you have seen that for the project. And today it is some figures. Today, more than 7 cities are involved in the program or ready to be part of it. We know that around 800 healthcare professionals have been trained as part of the program. And we know that more than 8,000 seniors are today benefiting from the program. So that's huge numbers. But beyond the numbers, what is the most important, to my opinion, in terms of systemic change, it is about how the program is now becoming a reference, a kind of best practice for the Netherlands, and is included in the policies, as we have heard, or in guidelines. As an example, some components of the programs have been really part of the frailty diagnosis in the Netherlands, or the fall prevention guidelines and practices. And the program is endorsed by the Ministry of Health and is part of the National Elderly Pact, which all that, to my opinion, is really what we ambition, to start from a pilot phase, as we have heard, to move to test, to improve, and to scale to the point of really systemic change in the Netherlands for the health of the senior people.
And it's not just systemic change, right? It's very holistic as well. It goes from the food that our elderly will chew to health policy on a national level. This is a complete package, if we can say. We've talked about the model. You've just told us how much it works, how the beneficiaries actually, their lives, how it can improve through that problem. But let's be honest, there's a gap always between the model and reality. There's always something you got to fix, something you have to adapt to. And I would like to know about the learning curve of these projects, because if you're willing to replicate that project in your city or in your country, then there are probably a few hiccups you might avoid by just listening to our experts this morning. And I'd love to hear the stories, actually. I'd love to hear what they've learned. So if our viewers wish to actually duplicate that model, what should they look for, or what should they be doing? Nicolas, I'll go back with you, because you just told about this holistic and comprehensive model. What did you learn along the way by implementing this project from a model to now 7 cities?
For me, if there is only one learning, this is to think impact and evaluation from day one. Even before starting anything, just the conception of the project should be driven by the impact that we want to generate at the end. Because then you think about your objectives, you think about the current situation, you build the theory of change, and you build around that the whole program. So that's really why we are able today to speak about this program at scale with the results that have been presented.
Let's turn back now to all our guests who are online with us this morning. Inge, your point of this, your TOM project manager, what is your advice? You've really literally made this thing come true. What did you learn?
I think I didn't do it, so it's the power of the coalition, which is the success factor, in my opinion, behind the program, Tom. And this power of the coalition, I think you can split it into 2 levels. That we have the partnership on a national level, so with players with a reach on national level. But also the partners more on a local, regional level. And I think that both type of partnerships are key. Yeah? The national partners more in the context of the development of the program, and also what Nicolas mentioned, the sustainability of the program, and including the financial sustainability. Yeah? With a health insurance company, the municipalities, thinking with you how to make the program more sustainable. And on a local level, partners like the local physiotherapists, the dietitians, and the welfare organization to really drive the implementation of the program. Another success factor I would like to mention is breaking the silos. So despite the fact that there is scientific evidence of the beneficial effect of nutrition in combination with exercise, dietitians and physiotherapists do not find by default each other. And the TOM program, with the structured multidisciplinary intervention, really helps to drive this collaboration, which is really a key element within the TOM program.
And within that collaboration, within that coalition, NGOs have a central role. So Saskia, what about you? What happened? What did you learn along the way creating this project?
I totally support what Inge just said, that are really valuable lessons we learned during the various living labs, when we started, when we evolved. I think what I learned most, and what I would like to express to the viewers, is test, learn, and evolve the approach or program. Don't try to make a very specific, exact blueprint. Keep the structure intact with the effective components, but leave room for regional and or local customization. But because that will be the biggest part of the success in sustainable implementation. I think the Living Lab studies provided really valuable insights for those implementation strategies, and to differ from them in every local municipality, what works best. And it gave us a very, various strategies that we can use also to work on the national scale up of this program. And we could not have gotten this far without the involvement and support of all involved stakeholders, professionals and elderly, as Inge already mentioned. This is a major part of the success.
And I assume that also was a new way of working for municipalities. So Nicole, as what could you tell to all the city or community officials that are watching today on your side? What did you learn? How did you make it work?
No, we also learned a lot. We learn still, because at this moment we have 3 TOM groups running in our city. Last Friday I visit one group, and after this meeting I go to another TOM group to join the lunch they have together. So, and I really agree with Saskia what she already mentioned, because it's very important for each district that you have to look very carefully to examine the social and economic and ethic characteristics of the older citizens, so that you have, together with the professionals of that specific districts, you have to tailor the program to their specific needs and adapt the program to the max, because every neighborhood, every part of the city is different, so you don't can roll out one way of the program is built up. You really have to adapt it to the max and look at the specific districts and tailor the program to the elderly who lives there, and adapt to their needs.
And as you all mentioned, this is a collective effort. It takes members of the community, it takes healthcare professionals, but companies also have to be a part of this. So last but not least, Evren, from a company perspective, how can they contribute?
I think there are 2 very important things from the company perspective. First of all of the speakers mentioned, but I think repetition is good. Holistic approach is extremely important. Throughout the program, we learned that nutrition alone is not relevant without a holistic approach. So this coalition, breaking the silos, breaking the fragmented approach, it's extremely important also for the companies like us. And then the second thing, the businesses have very short-term objectives, right? But this type of a program requires a very long-term vision, a passion, a conviction, and a dedication behind it. And in order to make it happen, you need to have a team. And from the company perspective, you need to have actually a program manager with passion, who is able to connect ideas, who is able to connect different people. Super important that we have the team and we have one person who is dedicated with passion for a long time. And in this case, in this program, it was Inge Mohede in the case of TOM program. But believing in it, having a long-term vision, and holistically working collaboratively definitely makes it a big success, as we also heard from the numbers and from some qualitative results that made the program as the best practice.
So if I understood correctly, if you want to make things happen, if you want to take care of our elderly in a more sustainable and pragmatic approach, measure impact, create a coalition, test and learn, adapt, and trust your people. And this is as clear a roadmap for systemic change as I've ever heard. So I think that's actually the best conclusion we can have to today's webinar. Thank you all for being with us this morning. Thank you, Nicolas, for having us at your place. Thank you all for joining us from the Netherlands live this morning. Thank you very much to Pauline and Marion for making this webinar happen. Thank you, of course, for your attention. The replay will very soon be available, but more than that, if you want to know more about the program, about the TOM model, you can join the Danone Ecosystem on LinkedIn. Stay tuned, and all I can do is wish you a very good day, and actually wish you all to be as healthy and independent as Hans when you reach 91. So, see you soon.